Scenario: a 65-year-old male presents with acute right lower quadrant abdominal pain. On examination, there is tenderness in the right lower quadrant with rebound tenderness. What is the most likely diagnosis, and what is the appropriate management? A. Acute gastritis, conservative management. B. Acute pancreatitis, antibiotics. C. Acute appendicitis, appendectomy. D. Acute diverticulitis, high-fiber diet. Answer: acute appendicitis, appendectomy. Explanation: acute appendicitis typically presents with right lower quadrant pain and is a surgical emergency. The treatment of choice is surgical removal of the inflamed appendix, appendectomy. Scenario: a 45-year-old female with a history of cholelithiasis presents with severe right upper quadrant abdominal pain radiating to the back. She is jaundiced. What is the likely diagnosis, and what is the definitive treatment? A. Acute gastritis, proton pump inhibitors. B. Acute cholecystitis with common bile duct obstruction, urgent cholecystectomy and common bile duct clearance. C. Pancreatic cancer, palliative care. D. Acute pancreatitis, conservative management. Answer: acute cholecystitis with common bile duct obstruction, urgent cholecystectomy and common bile duct clearance. Explanation: in this scenario, the likely diagnosis is acute cholecystitis with common bile duct obstruction. The definitive treatment is urgent cholecystectomy and clearance of the common bile duct. Scenario: a 30-year-old male sustains a deep laceration to the forearm while using a chainsaw. What are the key principles in managing this injury, and what complications should you watch for? A. Key principles include wound exploration and layered closure. Watch for nerve injury. B. Key principles include wound irrigation and antibiotic administration. Watch for skin discoloration. C. Key principles include hemostasis, wound exploration, and nerve assessment. Watch for compartment syndrome and infection. D. Key principles include immediate amputation. Watch for delayed wound healing. Answer: key principles include hemostasis, wound exploration, and nerve assessment. Watch for compartment syndrome and infection. Explanation: traumatic wounds require hemostasis, thorough wound exploration, and assessment of nerves and vessels. Complications to watch for include compartment syndrome and infection. Scenario: a 50-year-old obese woman with a history of hypertension presents with sudden onset, severe chest pain radiating to the back. What is the likely diagnosis, and what is the immediate management? A. Acute myocardial infarction, thrombolytic therapy. B. Aortic dissection, blood pressure control with beta blockers and surgical consultation. C. Acute pulmonary embolism, anticoagulation therapy. D. Stable angina, rest and nitroglycerin. Answer: aortic dissection, blood pressure control with beta blockers and surgical consultation. Explanation: the presentation suggests aortic dissection, which is a life-threatening condition. Immediate management involves blood pressure control with beta blockers and surgical consultation. Scenario: a 60-year-old male smoker with a history of intermittent claudication presents with a painful, cool, and pale left foot. What is the likely diagnosis, and what are the initial steps in management? A. Diabetic neuropathy, pain management. B. Acute limb ischemia, anticoagulation and vascular surgery consultation. C. Gouty arthritis, colchicine and NSAIDs. D. Cellulitis, antibiotics and wound care. Answer: acute limb ischemia, anticoagulation and vascular surgery consultation. Explanation: the presentation suggests acute limb ischemia. Initial steps include anticoagulation and vascular surgery consultation to restore blood flow. Scenario: a 25-year-old male presents with recurrent epigastric pain relieved by antacids. Upper endoscopy reveals a large gastric ulcer with visible vessels. What is the likely diagnosis, and what is the next step in management? A. Gastroesophageal reflux disease, GERD, lifestyle modifications. B. Gastric cancer, surgical resection. C. Bleeding gastric ulcer, endoscopic hemostasis with injection, thermal coagulation, or clips. D. Duodenal ulcer, proton pump inhibitors. Answer: bleeding gastric ulcer. Endoscopic hemostasis with injection, thermal coagulation, or clips. Explanation: a bleeding gastric ulcer requires endoscopic intervention for hemostasis, which can be achieved through techniques like injection, thermal coagulation, or clips. Scenario: a 30-year-old female presents with a painful, swollen left leg. On examination, the calf is tender, warm, and erythematous. What is the likely diagnosis, and what is the initial management? A. Achilles tendinitis, rest and physical therapy. B. Deep vein thrombosis, DVT, anticoagulation therapy. C. Plantar fasciitis, orthotics and stretching exercises. D. Osteoarthritis of the knee, NSAIDs and knee bracing. Answer: deep vein thrombosis, DVT, anticoagulation therapy. Explanation: the presentation suggests DVT. Initial management includes anticoagulation therapy to prevent clot propagation and embolization. Scenario: a 40-year-old male presents with recurrent, severe right upper quadrant abdominal pain after meals. He has a history of heavy alcohol consumption. What is the likely diagnosis, and what is the initial management? A. Acute pancreatitis, fluid resuscitation and pain control. B. Alcoholic gastritis, proton pump inhibitors. C. Acute cholecystitis, urgent cholecystectomy. D. Hepatic abscess, antibiotics and drainage. Answer: acute pancreatitis, fluid resuscitation and pain control. Explanation: the presentation suggests acute pancreatitis, likely due to alcohol consumption. Initial management involves fluid resuscitation and pain control. Scenario: a 55-year-old male with a long history of smoking presents with chronic cough, hemoptysis, and weight loss. On imaging, there are regular masses in the lungs. What is the likely diagnosis, and what is the standard treatment approach? A. Bronchitis, bronchodilators and antibiotics. B. Pneumonia, broad-spectrum antibiotics. C. Lung cancer, surgical resection, chemotherapy, or radiation therapy. D. Tuberculosis, anti-tuberculosis medications. Answer: lung cancer, surgical resection, chemotherapy, or radiation therapy. Explanation: the presentation is suggestive of lung cancer. The standard treatment approach includes surgical resection, chemotherapy, and/or radiation therapy depending on staging and histology. Scenario: a 70-year-old male presents with abdominal distension, constipation, and colicky abdominal pain. On examination, there is a palpable mass in the left lower abdomen. What is the likely diagnosis, and what is the treatment of choice? A. Irritable bowel syndrome, IBS, dietary modifications and antispasmodics. B. Diverticulosis, high-fiber diet and stool softeners. C. Colorectal cancer, surgical resection and possible adjuvant therapy. D. Diverticular abscess, antibiotics and percutaneous drainage. Answer: colorectal cancer, surgical resection and possible adjuvant therapy. Explanation: the presentation suggests colorectal cancer. The treatment of choice is surgical resection, and adjuvant therapy may be indicated depending on staging. Scenario: a 25-year-old male sustains a blunt trauma to the left side of the chest in a car accident. He presents with decreased breath sounds on the left side, hyperresonance on percussion, and tracheal deviation to the right. What is the likely diagnosis, and what is the immediate management? A. Pneumonia, antibiotics and oxygen therapy. B. Tension pneumothorax, needle decompression followed by chest tube placement. C. Rib fracture, pain management and respiratory support. D. Pleuritis, nonsteroidal anti-inflammatory drugs, NSAIDs. Answer: tension pneumothorax, needle decompression followed by chest tube placement. Explanation: the presentation suggests tension pneumothorax, a life-threatening condition. Immediate management involves needle decompression followed by chest tube placement to relieve the pressure. Scenario: a 35-year-old male presents with a painful, swollen right leg and difficulty breathing. He has a history of immobilization due to a recent fracture of the right leg. What is the likely diagnosis, and what is the initial management? A. Cellulitis, antibiotics and leg elevation. B. Acute compartment syndrome, surgical fasciotomy. C. Pulmonary embolism, anticoagulation therapy. D. Osteomyelitis, intravenous antibiotics and surgical debridement. Answer: pulmonary embolism, anticoagulation therapy. Explanation: the presentation suggests pulmonary embolism, likely due to immobilization. Initial management involves anticoagulation therapy to prevent further emboli.